Hey, my awesome people, hope you will be doing awesomely well. This is the last phase of your exam in which you are standing now, just few days left, and I am not going to waste or use much of your time. In this time, I am going to repeat some of the previous year questions from the subject called medicine. Medicine is something which is very vast, and many people fear this subject. So, via this video, I am going to repeat some of the important last year questions, and what you need to do is you need to take a pen and paper and note down the important topics, because these questions may not get repeated but the topics will get repeated. So by this video you will be coming to know the important topics as well as the repeat questions if they get repeated. So starting with, the cerebral edema is the most dangerous complication of diabetic ketoacidosis. So one topic is DKA, for which you should know everything. So revise DKA. Insulin resistance in liver disease is due to steatosis. So among the four options, the correct one will be steatosis. Now you can just plug in your earphones while you are asleep and listen to all of them. So in this part I will discuss 50, in second part the rest of them. Type of glomerulonephritis is least likely to cause chronic renal failure is minimal change glomerulonephritis. Another important topic from pathology and medicine is glomerulonephritis, everything about it. Signs and symptoms of chronic renal failure appear when GFR goes down 50%. So CRF. Painful pericarditis is not a feature of CRF. Again, CRF. Restless leg syndrome is seen in chronic renal failure. Treatment of restless leg syndrome is gabapentin. Nail and half nail sign is seen in uremia is due to increased capillary density at distal half of nail. So 2 points you got: nail and half nail sign, which is a sign of uremia, and it occurs due to increased capillary density at distal half of nail. Band shaped keratopathy is most commonly seen in chronic renal failure. So CRF is one topic you are just going to open from medicine and read that. In digoxin poisoning, dialysis is not needed, because digoxin is something which is tremendously distributed in tissues, and that is why hemodialysis is not effective for digoxin removal. So in digoxin, dialysis is not done. So among the four options in which hemodialysis will not be effective in their poisoning, the answer will be digoxin. Fluid used in peritoneal dialysis is rich in dextrose. Ankylosing spondylitis is associated with HLA-B27. Schober's test is done for ankylosing spondylitis. So ankylosing spondylitis is another important topic. In Schober's test, they may also give you the picture of Schober's test, in which you will see a patient who is standing and then flexing like this, means lumbar flexion. So what happens is, the examiner marks 2 points on the patient's back, one at the level of sacral and other 10 centimeter above that. Now when the patient bends forward as far as possible, the distance between the two marks is again measured. Normally the overlying skin stretch up to or 215 centimeter, and any value less than this or less than 5 centimeter is indicative of problems like ankylosing spondylitis. So bamboo spine and many things related to ankylosing spondylitis is important for you. Treatment of choice in seronegative spondyloarthritis is indomethacin. So in option, the answer would be indomethacin, seronegative spondylitis. Subcutaneous nodule is not seen in Reiter's syndrome. Reiter's syndrome, important topic. Chlamydia most commonly causes reactive arthritis. Succinate balanitis is seen in Reiter's disease. Again, Reiter's disease. Keratoderma blennorrhegica is seen in Reiter's disease. Patrick test is done for sacroiliitis. Microalbuminemia is most reliable marker for diabetic nephropathy. ACE inhibitors are given as nephroprotective drug. Comment me why. Unconjugated bilirubin is absent in urine because it is attached to the albumin. So in the option, which of the following you won't get is in the urine is unconjugated bilirubin. Unconjugated hyperbilirubinemia is seen in hemolytic anemia. 5. Nucleotidase activity is increased in cholestatic disorders. HYS scan is done to diagnose acute cholecystitis. So HYS scan, acute cholecystitis. Earliest dyslipidemia to occur in diabetes is raised triglycerides. Legacy effect or metabolic memory is related to serious complication in diabetic mellitus. Telmisartan is the only ARB which acts on PPAR gamma receptor. So all the antilipidemic drugs you have to remember, and this newer drugs also. So telmisartan is the only ARB which acts on PPAR gamma receptor. Seroglitazar acts on PPAR alpha and gamma receptor. So this PPAR gamma receptor acting drugs you need to know. Councilman bodies very frequently asked these. There are some 30 bodies which you need to remember for your exam. Councilman bodies is one of them which has been asked. Is seen in acute viral hepatitis. Seroglitazar, which I am again repeating because sort of newer question, acts on PPAR alpha and gamma receptor. Telmisartan was only acting on gamma receptor. Commonest hepatotropic virus progressing to chronicity is hepatitis C virus. Now, hepatitis is another important topic. Do revise it. Chances of vertical transmission in hepatitis B is 90%. Microalbuminuria is most reliable marker of diabetic nephropathy. Erythromycin acts on motilin receptor in diabetes. In DM, third nerve is most commonly involved, but pupillary reaction remains normal. Callus formation is earliest manifestation of diabetic foot. Edema in nephrotic syndrome is predominantly due to hypoalbuminemia. Most common cause of nephrotic range proteinuria in adult is diabetes mellitus. True about light microscopy in minimal change disease is that there is no change seen. So all the glomerulonephritis and the microscopic changes immunofluorescence pattern shown are very important. Tram tract appearance is seen in membranous membranoproliferative glomerulonephritis. Acute infection of hepatitis B is diagnosed by IgM antibody for HPC-AG, and acute replicative means when the active infection acute active, then it will be along with HBeAg. So that is hepatitis B infectivity. That means hepatitis B is now can be infective to other person because the virus is replicating. So it is indicated by HBsAg and HBeAg. So HBeAg denotes the replication of the virus. Reserve transcriptase of hepatitis B virus is coded on P gene. Important. Critical ischemia for peripheral arterial disease is if ankle brachial index is 0.3 and less. So this critical ischemia is also important. That is, the ankle brachial index is an important thing which NB people are asking. J phenomena is related to hypertension. So J curve phenomena you need to know. Most sensitive test for renal vein thrombosis is CT angiography. Post streptococcal glomerulonephritis secondary to skin infection is more common in summer. So this post streptoglomerulonephritis is also important. Malignant otitis externa, all caused by Pseudomonas. Rhinocerebral mucormycosis by fungus, very malignant disease, means spread and is very fatal, this mucormycosis, and you need to do a radical surgery to prevent its spread and to prevent the patient from dying. That means if it involves orbit, you have to do orbital exenteration. You are not going to only clear the disease but do the surgery radically and cure the immunocompromised status of the patient. That means if the patient is diabetic, then treat the diabetes of that patient along with the surgery. Reverse transcriptase of hepatitis B is on P gene. IgA nephropathy is seen in mesangial proliferative glomerulonephritis. Bronchial asthma is best diagnosed by demonstration of reversible obstruction. In idiosyncratic asthma, IgE is not increased. Aspirin sensitive asthma is associated with nasal polyp. Charcot Leyden crystal consists of granules of eosinophil. Bradycardia indicates most severe attack of bronchial asthma. So I think it exceeds 50, and now we'll continue in the second part. Thank you.